How long is the hepatitis A incubation period? Imagine catching a virus and not knowing it for a few weeks. That's what happens with hepatitis A. The incubation period for hepatitis A, which is the time from exposure to the virus until symptoms appear, generally averages about 28 days. However, this can vary quite a bit, ranging from as little as 15 days to as long as 50 days. So, if someone is exposed to the hepatitis A virus, they might start feeling sick anywhere between 2 weeks and 7 weeks later. Hepatitis A is caused by the hepatitis A virus, which mainly targets the liver. It usually spreads through the fecal-oral route, meaning the virus can be transmitted by eating contaminated food or water or through close contact with an infected person. Once the virus enters the body, it travels to the liver and begins to multiply. During this incubation period, the virus is actively replicating, but most people do not have symptoms yet and might not even realize they are infected. When symptoms do appear, they tend to come on suddenly. Common signs include fever, feeling very tired, loss of appetite, nausea, stomach pain, dark-colored urine, and jaundice, which causes yellowing of the skin and eyes. Interestingly, not everyone infected with hepatitis A shows symptoms, especially young children, who often have mild or no symptoms at all. Older children and adults are more likely to experience noticeable illness, with jaundice occurring in over 70% of those who do show symptoms. From a liver health perspective, hepatitis A is usually an acute infection that resolves on its own within a few weeks to 2 months. Unlike hepatitis B and C, hepatitis A does not cause long-term liver problems or increase the risk of liver cancer. However, in rare cases, especially in older adults or those with pre-existing liver conditions, hepatitis A can cause severe complications like acute liver failure. These cases are uncommon but serious. Because hepatitis A does not lead to chronic infection, it generally doesn't increase the risk of liver cancer. Still, any sudden liver injury can temporarily affect liver function. For people with existing liver issues, catching hepatitis A could temporarily worsen their condition, so medical supervision is important. Prevention is the best approach. Vaccination against hepatitis A is highly effective and recommended for travelers to regions where the virus is common, people with chronic liver disease, men who have sex with men, individuals who use drugs, and those experiencing homelessness. Good hygiene practices, especially thorough hand washing, also play a crucial role in preventing spread. If you think you've been exposed to hepatitis A or are experiencing symptoms, it's essential to see a healthcare provider. Most cases recover fully without long-term effects, but medical guidance can help manage symptoms and prevent transmission to others. In summary, the incubation period for hepatitis A usually lasts about a month, but it can be shorter or longer depending on the individual. The infection is typically acute and self-limiting, with most people recovering completely. While it does not cause chronic liver disease or increase the risk of liver cancer, rare severe cases can happen, especially in vulnerable groups. Protecting yourself through vaccination and good hygiene is the most effective way to keep your liver safe. Always consult healthcare professionals for personalized advice and care.